Some of them would have to give a just short statements, and then the program will continue proper. Well, since I first called CRS to the high table, I am giving him less than 3 minutes to make a statement.
Thank you. Good morning, everyone. CRS always feel honored to be in partnership with the government, specifically the National Malaria Control Program. Our relationship with the Ministry of Health through NMCP has been going on for a very long time. I think nearly 10 years now. During round 9 of the Global Fund Malaria Project, we started that partnership as a sub-recipient for the ministry. And today, with the respect given to CRS by the ministry, we are currently a co-principal recipient to the ministry. So that's why I started my speech with us being honored with the partnership with NMCP. So I don't want to take much of your time. CRS, we are always saying we are proud to be part of that partnership, and we are committed to working with National Malaria Control Program and the Ministry of Health in the fight against malaria and other life-threatening diseases. I thank you.
Next, to make a very short statement, is the National Coordinator for the Health Reporters Network, in the person of Dr. Swaluvandi.
I just don't know why you like to call me a doctor, not one. However, maybe that's a prophecy in the near future. Chairman, all protocols observed. Good morning. As rightly said by the moderator, I'm not used to making short speeches, but I'll try as much to actually give the shortest this morning. Let me start by welcoming all of you here. I know most of you have traveled from the provinces, and James coming all the way from Senegal, arrived here days back. You're all welcome. I want to assure you of your safety in this hall and beyond. As National Coordinator of the Health Reporters Network, I feel very much pleased to be part of this second gathering organized by Speak Up Africa in collaboration with MOHS via the National Malaria Control Program, and with strong support from the Health Reporters Network. Can we clap for the Health Reporters Network? It wasn't easy forming this organization. You know, bringing journalists together from all over the country. Those of us who've practiced journalism, we know what it means. But with our effort, I mean my very self and my able national executive. Can the national executive stand up, please? All those parts of the national executive, Jonal, Richard, Khadija, Iskemo Chamaram. Let's give these people a very big hand. To be very honest, 2 years back when I initiated the idea of bringing journalists who report for health together, it wasn't easy for me. we were having our meetings at the beach. Sometimes we do have our meetings at individual houses. But with the support of these people I've just said should clap for, the work was so easy. Jonal is here around. I most time tell him, you own this organization. Because when we met Speak of Africa, via the then PRO of the Ministry of Health and Sanitation, Solomon Rogers, I was so busy with other work, but I had to hand over Jonal to Aminata, and I think Aminata has enjoyed working with Jonal more than my very self. So, Jonal is a very nice person, and of course, he has worked so much to ensure that we had our first gathering, which was held at the Swiss Hotel, and our second gathering here at Cat School. You know, you may want to know why we actually established this organization. It's very simple. We over the years found out that journalists just report on health issues the way they want. But reporting for health, you must be trained. There are terminologies used by the health practitioners. If you do not know how to interpret them, you might give the wrong message to the audience. I dedicated my life to health reporting since I entered journalism. And I just thought it fit that yes, the knowledge I've acquired should be shared among my colleagues. And so I had to unite them all over the country to ensure that yes, we go through trainings that will capacitate us to report well in terms of health. I tell you, my brothers and sisters, if we do not have a good health, we will definitely not do any other thing. We shouldn't have been here today without good health. And one thing that ensures that yes, we have good health is when the journalists probe into things that are affecting our health sector and make it public. That is one of our goals. We have fought over the years to discourage our membership from event-based reporting. What do I mean by this? It has become a rule rather than an exception for journalists to just be waiting for invitations to attend a program, invitations to see that yes, the minister is going elsewhere, you follow and you report, and you are giving something else at the end of the day. That is not what we want for the health reporters. We want a union, an association that will sit by and look at things affecting society, probe into them, and then make them public for solutions. That is what I have been preaching to my membership. And that is exactly what we have been doing. We discourage our membership from just sitting by to waiting for invitations and attend events, and at the end of the day, do a kind of PR, public relation, for those organizations that invite them. That is not what we want for the health reporters. And I think that is what that has actually made us sail it through whatever we have been doing. I promise not to make a very long speech, and I will try to summarize at this point. But I must say emphatically that our membership is committed to improving the health sector of Sierra Leone. Malaria is one of the diseases that is killing us. But I tell you for free, people do not know. When somebody gets malaria, he treats it with carelessness. But I tell you, it kills more than the corona itself we are now afraid of. Prove me right or wrong. It kills more than the HIV that you do not want to get. Prove me right or wrong. So why are we treating malaria carelessly? Why are we treating it carelessly? It is our appeal, and we have been preaching this to not only our membership, but the nation through our different programs, that malaria is a killer disease and must be treated with all seriousness. So if we are gathered here today, it is not because we want to just see faces that we have not seen for quite a long time. If we are gathered here today, it's not because we want to get other things done, but it is because we know that malaria is serious and we want to treat it with all seriousness. So colleagues, I mean my membership, the Health Reporters Network, As we've been doing, let's continue the good work. Let us probe into communities that are actually affected by malaria, disturbed communities and others, and actually get their views, get solutions to their problems. I tell you for free, you might not know the impact of what you report today, because probably you just think you are reporting just because you are a journalist. But be rest assured that if the government is treating malaria serious today, if partners are treating malaria serious today, it is because we journalists have been reporting the negatives in society. It is because we've been digging out communities that are actually affected by the disease and letting it to the public. So this is why we are even having this gathering today. Ladies and gentlemen, I can see the chairman standing, which means I've spoken beyond time. So at this point, I want to conclude by saying, you're all welcome here, and thank you very much.
Can we clap for him, please? Yes, he deserves that. At this point in time, can we put our hands together for the Deputy Program Manager for NMCP as he makes a short statement, not as long as Swallow Van is, but he has liberty actually. He is the custodian of this program today. Sir, at your own time. God bless.
Thank you very much. On behalf of the Ministry of Health and Sanitation and the National Malaria Control Program, I want to bring greetings to everybody here from our Honorable Minister of Health and Sanitation, Professor Alpha T. Muri, his deputies, and the entire senior staff of the ministry. I'm apologizing on their behalf for not being here because of this COVID and many other health activities in the ministry. You know, they are always engaged. Ladies and gentlemen, I want to first of all confirm from the previous speaker. Here in this country, we are all afraid of HIV/AIDS. Now we have the COVID-19. Everybody is afraid. That is why we are all wearing this mask, all these things. You know, nobody wants to die of AIDS. But to be honest, the statistics we have, malaria is more dangerous than any other disease in this country. I want to repeat that again. Malaria is almost killing people on a daily basis in Sierra Leone, especially the pregnant women and the under fives. So I just want to buttress that one. That is why the Ministry of Health and Sanitation is taking malaria control program very, very seriously. And even our donor partners, you are hearing of Global Fund, the amount of money they are bringing into this country to control malaria. And the American government, you know, the PMI, they are bringing in $15 million annually. $15 million every year to control malaria. That money, please, is not going directly into the Ministry of Health and Sanitation or to the malaria control program. They have partners here. They have various partners who are helping us in the control of malaria. Again, if you look globally, including Sierra Leone, the incidence of malaria, because of all activities we are doing, is gradually decreasing. Gradually decreasing. In Sierra Leone, because of all the activities, distribution of bed nets, the treatment, etc., etc., the incidence of malaria is gradually decreasing, and the number of deaths also. So, I want to thank Speak Up Africa for bringing in this project here, Zero Malaria Starts With You. Because it's just not all countries in Africa, it's just few countries where Speak Up Africa is implemented Zero Malaria Starts With Me. So, I want to thank them. So definitely the contribution they are going to make will speed up the decrease of malaria incidence and the death. Because their whole focus is you people, the media. Because whatever we do as a program or as a ministry or even by the government, if the people actually don't know the meaning, the value of those activities, definitely will not go anywhere. So it is you, these people, who are helping us in the ministry to reduce the incidence of malaria. You remember, Zero Malaria Starts With Me was launched in 2019, the 25th of April 2019, by the Honorable Minister of Health and Sanitation. And since then, a lot have been done. Also, 6th of February, I think I can remember, the Malaria Midwife Coalition was launched. And from that time to now, you have done a lot. Honestly, as I'm working as the Deputy Program Manager, we are seeing the impact of all the productions you people are making. Even my office, the number of journalists visiting me for data, for information, and those data they collect, they don't just keep. You always see those publications. So that one is very good. Despite the COVID-19 that is actually slowing down our progress, but a lot has been done by you. Since the launching this year, that's about 6 months ago, you have created a lot of impact for you. On behalf of my ministry and the program, I want to say a very big thank you to you all. For example, we have just completed the mass campaign, the bed net distribution, 4.6 million bed net distribution, and honestly, if I'm going to give grade, to the contributions, I'm not including those who provided the funding, CRS, Global Fund, PMI, no, but all other activities I think I will give you 100% contribution in an award. So you have to clap for yourself, the media. So, ladies and gentlemen, for the past 6 months, we know we've had successes. But again, we have a lot of challenges. So we are meeting back today so that we look at those successes and the challenges we have. So because this is something that we have to make sure that there is stability and success all the time. So today, I think we have the opportunity to look at the successes and the challenges and set up, the steps we are going to embark on so that this malaria midwife coalition will continue to bring the successes in the control of malaria in Sierra Leone. I thank you for your attention. Please.
Can we clap, please? Put our hands together as we welcome the PRO for the Ministry of Health and Sanitation, representing the Chief Medical Officer in this program.
Thank you very much. I'd like to stand here and do it very briefly. Good morning, colleagues. Are we together? I'm still a journalist. You know that very well. Chairperson of this occasion, high table, ladies and gentlemen, I'm happy to be here today and to say I want to apologize because the Chief Medical Officer, who was to be here to make a statement and officially declare this conference open, is not around, and he extended his apologies for this. I'm going to be very brief because the coordinator for this program, Swaliho Vandi, Mr. Swaliho Vandi, we started this health business ever since when I was a small boy. You know, when we were in school, we started with the Sierra Leone Red Cross Society as volunteers. So when I became the president for Reporters Union, Swaliho Vandi was reporting for a radio station in Kenya. I told him, you have to come over. When he came over to AYV, he wanted me to be part of his program, but that is one aside. Very wonderful program today. The issue of malaria is very serious, and even though transmission is stable in Sierra Leone, but there are still challenges. It means that health workers have been doing their best to see how they can communicate for behavioral change in communities, but it seems as if more efforts have to be done to ensure that people get the appropriate information that has to do with malaria in our community. Yes, individual journalists have been making frantic efforts to communicate, to advocate, but all of those efforts have not been very comprehensive. The organization now we are going to launch for today, I'm sure it has been launched, but we're going to really strengthen for today to move forward and push forward with this campaign on malaria in Sierra Leone. Yeah, so those individual efforts can only be realized when once you got a coalition, and that is why you have this network. And this is not the first time, I'm sure, in Sierra Leone networks have been formed to advocate on health issues. Remember, we got HARA, HIV Reporters Association. I was one of those journalists that was reporting on that. We also have other organizations, but I think this one stands to benefit the people of Sierra Leone because I'm sure all of those who are part of this network, who are part of this association or organization, have been reporting on health issues. Now, when you have a set of people reporting on a specific issue, it deals with thematic reporting. And that is what is really lying in Sierra Leone. Over the years, and since I was practicing, I used to be reporting on politics, I report on human rights, I report on a whole lot of other things. Well, I'm still reporting on them, but at a very different level now as Public Relations Officer of the Ministry of Health and Sanitation. But what is important is that once you have a focus, once you're reporting on thematic issues, it means that you can be well trained, it means that you can understand better the jargons, it means that you can be able to engage those professionals who are providing the services for you. And that is why I want collectively all of us to put our hands together for a coalition that is being headed by Mr. Swaliho Vandi. Please. My only advice would be that it is not about money. Like he said, it is not about you going to cover press conferences just to report on he says, they says, I says. This is that has been happening within the journalistic landscape. Very important that we like to mention, you've got various strata of media organizations in this country. And I'm sure the network or the coalition will look into that. You have commercial radio stations whose journalists really bent on looking out for money. They want money for their institutions, right? You have religious radio stations, for example. You have community media network. As we speak, I'm coordinating 50 community media networks in Sierra Leone who are reporting on right to food issues. And so, Mr. Coordinator, I will appeal that you deal with community medias very strictly, because this thing of malaria has to do with people in those remote communities. The Ministry of Health and Sanitation, you heard from Dr. Ture, has distributed, and partners, have distributed bed nets to communities. But if you go to those communities, they are now using those bed nets for fishing purposes. So it means it is not all about reporting what he says, this says, I says. It is about going to those communities and make sure that the rightful information, reach them. In February, like Dr. Ture said, this network or the campaign on Zero Malaria started, and the network formed, and they are going forward to see how they can sensitize the people of Sierra Leone appropriately. On behalf of the Ministry of Health and Sanitation, I don't want Mr. Chairman to stand up again and ask for time. On behalf of the Ministry of Health and Sanitation, and on behalf of everybody here, I want to say thank you very much for giving me the opportunity to talk about my ministry in this August gathering. And I'm really happy, I really appreciate the funders and my brother who's coming from Senegal, and all of those, Madam Amina, who has been going up and down to see that things happen this way. And so, also to the journalists who came from various parts of the country, I'm really pleased. For some time we've not met, but this is an opportunity to interact again in another capacity as your public relations officer. Thank you very much, and I now declare this confer I will use very open. Thank you.
Now that the program is declared open officially, Zero Malaria starts with me, and when the choir has spoken, nobody has the right to say any other statement. I therefore want you all to stand and do me this favor. Can we all just do this? Everybody stand up. We want to pledge to the CM. Now that he has declared the Zero Malaria starts with me, we want to promise and pledge to him that Zero Malaria starts. Can we say that together? Zero Malaria starts. No, I want a tone voice, please. I want a tone voice. 1, 2, go. Zero Malaria starts with me. Again. Zero Malaria starts with me. Can we say that in Creole? Let's say it again. Thank you very much. So, CMO representative, we have pledged that malaria in Dongwan, we have. It implies that all of us seated here will carry responsibilities to end malaria by 2030, as it is the aim of the NMCP. I thank you very much. We now welcome our presenters, our facilitators,
especially the NMCP and from the Health Reporters Network for making this happen. Thank you to all of you for coming out, and especially for those of you who've come very far. And I know it's been very rainy the last few days, so I hope the road wasn't too bad. I'm going to give an update to the campaign. If you remember from the first event we had, I gave a bit more background and context to the campaign as a whole, which I'm not going to do too much of that this time, because I think you all know already. But just again, for those of you who maybe weren't here last time, Zero Malaria Starts With Me is a campaign that was originally a national campaign in Senegal, which was led by PATH, Speak Up Africa, along with the Ministry of Health, and it was only a national campaign for a few years.